If you have a degenerated disc that has failed all non-operative management and your back pain does not improve with physical therapy and medication, your doctor may recommend disc replacement. In this procedure, the damaged disc is removed and replaced with a synthetic disc and other artificial parts. This procedure might be considered similar to hip or knee replacement. The procedure is done with an incision through the abdomen. The damaged disc is removed and a new artificial disc is put in its place between the two vertebrae. This procedure is a relatively new procedure in the United States, but it has been used in Europe for more than 10 years. Unlike spinal fusion, disc replacement allows the affected segment of the spine to keep some flexibility and more normal motion. Recovery time may also be shorter than with spinal fusion since the bone does not have to knit. In addition, disc replacement avoids disrupting the segment above or below the disc that is replaced. This preserves the natural anatomy of the unaffected lumbar discs. An important point to keep in mind is that the artificial disc is not a soft material and it does not restore or replace the disc that is removed. The replacement disc approved for use in the United States has a plastic core sandwiched between two metal plates. Complications associated with disc replacement surgery are similar to those that may occur with spinal fusion and include damage to blood vessels, mechanical failure of the implanted disc, abnormal blood clotting, and a temporary increase in leg pain. Intrathecal drug delivery, that is, drug delivery into the spinal fluid, involves the spinal administration of opioid or morphine-like analgesics or painkillers via an implantable, programmable drug delivery system. Your doctor may recommend this option if you have chronic lower back pain that was not relieved by physical or oral drug therapy or surgical intervention. It may also be suggested if oral opioids relieve your pain but also cause side effects that you cannot tolerate. Once it is decided that you may benefit from intrathecal drug delivery, you will have a trial of this approach to delivering medication. This usually involves placing a small plastic tube or catheter near the portion of the spinal cord involved in your pain. The tube is connected to an external pump and treatment is delivered for 2 or 3 days. If the trial run is successful, a permanent system can be implanted. The procedure is similar to implanting a neurostimulator. Pain management specialists, neurosurgeons, and other doctors who specialize in spine disorders implant the pump. Surgery is done on an outpatient basis and usually takes 1 to 3 hours. You will have anesthesia during the procedure and probably be able to go home the same day. A small incision is made near the spine, and the catheter or small plastic tubing is inserted into the spinal fluid and secured there. The catheter is threaded under the skin around to your belly where the pump will be implanted. The catheter is attached to the pump and medication is allowed to flow from the device through the tubing. The pump implanted will probably be programmable to deliver the drug in different dosages at different times of day according to your needs. The pump is easily refilled. The frequency will depend on how much drug you need to infuse each day. The drug being used in your pump will probably be an opioid medication similar to one that you've already taken orally. The great benefit of the pain pump is that much less medication is required to get the same effect. When you take pain pills, the medication must travel through your gut and then your bloodstream and ends up having about the same concentration in all parts of your body. Achieving a concentration high enough to relieve your pain may lead to side effects such as constipation, sleepiness, upset stomach, and difficulties concentrating. Placing the medication directly into the spinal canal means that there is less in the bloodstream and fewer unwanted side effects. According to some results, the best candidates for intrathecal drug delivery are those who respond well to oral opioids but cannot tolerate their side effects. The intrathecal drug delivery allows mixing of pain medications so that patients can take smaller amounts each day while achieving better pain relief. Newer pumps also allow patients to give themselves additional doses if needed for breakthrough pain. However, Your pain specialist should program the pump to provide these additional doses within safe limits to avoid overdose. Although rare, complications from implanting the intrathecal pump can occur. The most common ones are infection, bleeding, injury to the nerves or spinal cord, and leakage of the fluid that surrounds the brain and spinal cord. Because the tubing of the pump is placed in the space around the spinal cord, an infection or bleeding could be dangerous and even life-threatening. It can cause permanent nerve damage and even paralysis. For these reasons, use of a pain pump is usually considered only when other therapies have failed and surgery is not an option.